Finally, a solution for active baby boomers who've worn out their hips too soon. No longer do they have to wait until their 60s to find a fix. Local doctors are now offering a new alternative to the traditional hip replacement. When Kathy Klein was photographed for this story on Evening magazine in the fall of 2005, she was in a lot of pain. Hiding it soon became impossible.
I was unable to do my kicks and even walk at that point.
Kathy needed a new hip, but knew that a conventional joint replacement wouldn't give her the range of motion she needed for those high kicks. Fortunately, there's now an alternative, hip resurfacing, which works much like capping a tooth. Because more of the bone is preserved, it functions and feels more like a natural hip. But not every patient is a good candidate.
They have to either be young or have bone that is.
Seattle doctor James Pritchett says hip resurfacing itself isn't new, but earlier attempts produced less than satisfactory results. Newer metals have made all the difference.
That low friction means it's going to wear very little also. Well, gosh, so when we got rid of wear, and if we can keep the bone, we've really got something that's pretty good.
So good it might just last the rest of a patient's lifetime. Unlike conventional hip replacements, which wear out, one drawback, the procedure requires greater surgical skills, but patients do recover faster.
One of the first things they come back and tell you is, I can sleep now, and not only better, but in any position I want.
For Kathy, who is the first female outside of Japan to earn a 7th degree black belt in karate, it means she's gotten the kick back in her kicks.
It was a huge boost for me to feel like I could get out and do what I used to do.
The British-designed Birmingham hip resurfacing system received FDA approval last spring. Other competitors are expected to be available later this year.